Welcome back to the last segment of the show. And again, that call-in number is 727-8750. If you have any burning questions or desires or any issues that are coming up, then please feel free to call that in and give me a topic to talk about for a few minutes. Anyway, one of the things that Ray did talk about on one of the previous shows was COPD, and I had kind of gone into a brief discussion on that. Chronic obstructive pulmonary disease, emphysema. I had quite a few slides on that, and I think I've talked about them previously on the show. It is a disease of basically obstructive airflow. So that means that the air cannot get out of your lungs as quickly as it can, and there's a lot of reasons for that. But the main reason happens to be when the airway becomes plugged with mucus. So what I talked about earlier was that in killing, when you smoke, the body kills the natural blood clearing or natural mucus clearing stuff. Oh, well, Ray is back on the phone. Ray.
Yes, I am, Doc.
Good.
I tried a couple times. I got a busy signal. I thought somebody else was on the line,
wow.
But I finally got through.
Okay.
I used to subscribe to a newsletter, Dr. Julian Whitaker, and he was of the mindset, maybe scientifically behind him, was as far as the liver rebuilding itself, if there's a portion of the liver that is healthy, something like milk thistle, or I think it's called silymarin, that's what I call it, can help to regenerate that liver if there's a small portion that is healthy. Is that correct, or is that just something that was like perceived at one time? If you could explain that.
You mean the liver, there was something he said that the liver would help to regenerate the liver?
Yes, it was milk thistle.
Yeah.
And silymarin. Now, that's how I pronounce it. It maybe it's a different pronunciation. But that the liver would regenerate if a small portion was still healthy. So if you can comment on that, I'd appreciate it. And you got a good show tonight. Thank you very much.
Yeah, you're welcome. You're welcome. Thanks for calling in. That is in fact, the liver regeneration. Milk thistle is supposedly a liver cleanser, but I don't know that it would actually promote liver regeneration. So I think that, unfortunately, was maybe a little twist on that. The liver is the only organ that we have that will regenerate on its own. It is in fact, liver, if you damage heart tissue, it basically scars. If you damage kidney tissue, it basically scars. So none of the other organs of our body except the liver is the only one that will regenerate. That is the reason that we get cirrhosis of the liver. For those people that undergo liver damage through either hepatitis or chronic viral infection or alcoholic cirrhosis or some other type of toxicity, we kill the liver or the liver cells die, and then they do form the scar tissue, and then the little bit of liver that is still alive will start to grow and replicate and start to basically try and grow in an encased scar structure. So if you have a scar tissue that's kind of in a ball, and then it has fibrous attachments to other areas of the body, and it starts to grow, it will stretch, and actually that will pull on and deform the liver in other areas. And that's why you get this nodular appearance in cirrhosis, because the liver is trying to regenerate itself, and eventually squeezes off the biliary ducts and will not let bile pass through the liver, so it basically goes back into the blood, and therefore you get jaundiced, and you don't excrete, you don't toxify, and then as the liver gets more congested and firm, blood flow from the splanchnic bed, all of your lower body and everything goes through the liver in the inferior vena cava. And those people with end-stage alcoholic disease will produce ascites. They'll produce fluid in their belly. They'll get edema in their lower extremities, because the liver, instead of it being a nice filter, it basically now becomes a clogged filter. And when you start third spacing fluid into your abdominal cavities and in your intracellular tissues, very ugly situation. It has to be drawn off, peritoneal. Basically, they'll open I guess they'll kind of put a kegger in there, and you'll kind of drain your proteinaceous fluid off of that. So that's why I encourage people to think about getting tested for hepatitis B and now hepatitis C, because they now have a cure for hepatitis C when before they didn't. It was very sparse. Certain genotypes, they could actually see which type of genotype you had on the hepatitis C virus. Some of them responded nicely to interferon and the other treatments, but some of them didn't. But now with all the viral research that has gone on with HIV and all those other things, now they have almost 99% cure rates for hepatitis C. And the key is to get your cure before your liver gets too cirrhotic or too stage 3, or past that you may have some troubles, and even though you cured the virus, you still may develop end-stage liver. So in answer to your question, I think milk thistle is a known herbal remedy. It may be a liver cleanser, but they kind of threw you a curveball when they say it would regenerate the liver. And that's the thing I don't necessarily like about vitamin salesmen and other things of that nature. They take a known fact that the liver regenerates, and they take an herb that we know may help in that area, and they basically tell you the truth that milk thistle will help your liver, but your liver will regenerate if there's a small amount of liver there. So they didn't lie, they didn't tell you a falsehood, they just kind of put the 1, 2 together, and the person who is not very knowledgeable will assume that milk thistle will help regenerate your liver. And that's the play on words that a lot of these products use to help generate sales for certain particular products. So you got to be careful with those particular things that you read out there. So I hope that answered your question with that. And I think that the key to liver health is basically watching the amount of insults that you throw at your liver through either alcohol or through other types of tissues and things of that nature. So it's very important that you not, and eventually, and if you drink enough, you're going to burst open some liver cells and you're going to kill them, and then those liver enzymes can be picked up in your tissues, and again, the liver dies, but the liver regenerates. So Tylenol is one of those toxicities that can happen there too. So I think we have another caller. Chuck, are you on the phone?
Yeah, Doc, great show. Absolutely wonderful.
Thank you.
There was reports both nationally and locally on the increase in medicine or prescription medicines since 2001. There was 2 studies, and basically it said people over 20 who are taking prescription medications almost doubled. And of course, with all the side effects, et cetera, I wonder if you're concerned that maybe the medical profession has swung too much in favor of chemistry, vice nutrition, the homeopathic direction.
I had a hard time understanding you a little bit. Can you just, what were you, for some reason the mic didn't come through, so tell me that again. I mean, I hate to.
Okay. Can you hear me better now?
Yeah, I'm wondering, could they maybe turn up the volume a little bit on the speaker, because and then could get a little bit of better input into that. So.
How about now?
Try again.
Okay.
Yeah, that's better.
Okay. There was a report today on national and local news about the doubling in prescriptions. Since 2001, there was a couple studies done. And my question is, with all the side effects, et cetera, and you mentioned the benefits versus risk, but I have a great fear that the medical profession has swung way too far in favor of chemistry over, the homeopathic / take care of your body approach to keeping us healthy and keeping us living longer.
No, that's a very, very good point, and a lot of that is patient expectation too, so that the patient comes in, and a lot of people would love to find a cure for their diabetes in the form of a pill, or they would prefer to cure everything with just taking a pill. So we've become an immediate based society, and everything that we out there that we envision as far as medicines that we make always come from natural products first. But I couldn't agree with you more that a lot of physicians just want to throw prescriptions out there to some people, and takes a long time with patients to convince them that everything that's affecting them is basically due to something that they've done to themselves, such as a poor diet or poor exercise or not taking care of themselves or doing too much of those things. And it's a very big barrier to overcome when you have someone that says, well, I just don't think that I can alter my diet, or my work dictates that I do this, or things are dictating that I do those. Those are really tough barriers, and sometimes physicians are painted into a corner where on the one side, if we are practitioners, on the one side, if we don't prescribe something for somebody, another person may look at it and say, well, why didn't you treat that illness, or why didn't you do that? So you're right. I mean, and what the pharmaceutical companies are doing to us in the form of, highway robbery and raping us in our pocketbook is an absolute criminal thing too. But of course, they'll never get prosecuted for that. So I think you're right on, Chuck. I really appreciate that comment, and we're almost out of time tonight, but maybe we can bring that up and talk about that next time. As far as there are some diseases that warrant a lot of medications, and there are some diseases that don't. And a lot of patients, I mean, when I see people bringing in bags full of medicines, I have to really go through them, and a lot of them are duplicated. And it's sad because they go to one place and get one prescription, they go to another place and they get another prescription, and they don't even realize that they're taking the same product twice. So med reconciliation is a very, very big thing. I mean, especially because we fractionated our healthcare so bad. We'll go to the hospital, and then we'll go to the urgent care, and the doctor, they didn't bring their prescription. The doctor does this, and one does that, and one does that, and next thing you know, they got 5 medications and wonder why they feel so bad. So anyway, we're out of time tonight, and thank you for that call, and maybe we'll bring that up on the next show. And again, thank you, Pahrump, for tuning in. I enjoy the show. I'm Dr. Reiner. We'll see you here next week.